Welcome to this quick summary of our late-breaking work project entitled Supporting Anaesthetists During Red Blanket Trauma Surgery, an analysis of work practices and requirements for a head-worn display. So what exactly is red blanket surgery? The term basically describes the rapid commencement of damage control surgery. The idea is to transport a patient who has suffered severe trauma in the pre-hospital environment as quickly as possible to the operating theatre, potentially even skipping the emergency department. The rationale for doing this is that usually the quicker surgery can commence, the better this is for patient outcomes. In our project, we wanted to study how head-worn displays can support physicians during red blanket surgery. Especially, we wanted to figure out how a system should be designed to continuously provide case-relevant information and so hopefully to allow clinicians to make the right clinical decisions quickly. To elicit user requirements for such a system, we conducted an interview study with 7 anaesthetists at the Royal Brisbane and Women's Hospital in Brisbane, Australia. Through the interview study, we learned that the workload of clinicians is incredibly high during red blanket cases, which can lead to the loss of situation awareness. Furthermore, we understood that a lot of different information sources have to be integrated during red blanket cases, which can be challenging, especially for blood tests, which are only accessible through a computer terminal in the corner of the operating theatre. Finally, when we talked to clinicians explicitly about head-worn displays, they were excited about the technology. However, they were concerned that head-worn displays might isolate them from their colleagues in the operating theatre because only they would be able to see what is displayed on the head-worn display, and so shared situation awareness might be difficult to develop. Based on the information provided by the clinicians, we developed this user interface for the Vuzix M400 head-worn display. The interface provides information about vital sign data, but also gives the wearer temporal awareness through timers and vital sign trend charts. Furthermore, to-do items are provided based on clinical algorithms, and test results can be accessed through button presses and through the issue of voice commands. If you want to learn more about our work, please consult the paper in the ACM Digital Library or speak to us during the CHI poster presentations.